It's no secret that I've had several bones to pick with America's health policies over the last several years. So how do I feel about a new report from the White House that intends to be the basis for some major health policy reform? That's the topic of this week's Healthcare Triage. Make America Healthy Again, a commission established by President Trump, released a report in May 2025 claiming to have exposed the key drivers of increased chronic disease in children. It points to factors including diet, lack of physical activity, and environmental toxins. Some of the health conditions the report lists include autism, depression, food allergies, childhood cancers, and obesity. We agree that some of these, obesity for example, are becoming more considerable issues. Increased trends of others, however, like autism and depression, might just indicate increased access to diagnosis and treatment. So just taking the issues that are clearly issues, does the report provide meaningful information about their root causes? If you read the press release, you would be under the impression that it does, because it specifically states that the report exposes a range of contributing factors. We, however, aren't so sure. And we aren't just writing this episode because we disagree on this point and want to prove ourselves. We're writing it because if we create policies based on the belief that specific factors are causing health problems, those policies will be a complete waste of time and money if those factors do not in fact cause the health problems we're targeting. Among many things, the report calls out ultra-processed foods, environmental chemicals like phthalates in plastics, screen time and social media, and medications like antidepressants and those prescribed for ADHD. We don't disagree that processed foods can be an issue. We've repeatedly stated that eating as much whole food as possible is a great thing, and that eating way too much sugar is a real problem. We also agree with the report on exercise. Yes, do more of that. It seems we agree on quite a bit in this area, outside of their note on page 27 on whole milk being an important part of a whole food diet. I've been talking about that since the early days of the channel. We do not need to drink milk. No, not even for strong bones. The milk emperor has no clothes. But I digress. What about the environmental chemicals? Let's take phthalates, which are used in so many products, including food packaging and personal care products, because they're really good at making plastic flexible. These chemicals are definitely in our bodies, and you've almost certainly seen headlines linking them to a lot of scary health outcomes. That's because you can absolutely find studies linking them, but, and this is important, those studies are so far providing extremely weak evidence to support their claims. If you examine the data in these studies, you'll find that there are so many confounding factors, and that the outcomes are both small in effect and extremely variable. That means it is exceedingly difficult to make any confident conclusions from them, and that there is no evidence strongly stating that phthalates are an issue for our health. Does that mean we think they're great to consume? Of course not. We can't imagine there's a reason for them to be in our food. But we can imagine the money and time to institute major health policies would have much bigger impacts elsewhere. And all of this can be said for food dyes too, which is another target of the Make America Healthy Again movement. And this is basically the case with most of the items in this report. Our understanding of what causes many of these health issues is lacking. In other cases, like vaccines, fluoride, and the relationship between sugar and ADHD, we have enough data to know these are not concerns, and we aren't going to dignify any false claims about those things here. Importantly, outside of studies being misinterpreted in the report, it appears that several of the studies cited don't even exist. The White House has claimed that this is due to formatting issues, though it remains to be seen how a formatting issue translates to the citing of non-existent research. Anyway, according to a press release, the commission now has 82 days to produce a strategy based on the findings of the report. The health of our children is really, really important, and it's disappointing that such a major push for improvement isn't based on a solid understanding of the data, or possibly on any data at all. Hey, did you enjoy this video? You might enjoy this other video on ADHD, autism, and acetaminophen. We'd appreciate it if you'd like the video and subscribe to the channel right down there. Maybe go on over to patreon.com/healthcaretriage, where you can help support the show, make it bigger and better. We'd like to especially thank our research associates, Edward Liljeholm and Joshua Crow, and of course, our Surgeon Admiral, Sam.